My name is Dr. Sarah Jacob. I am a general otolaryngologist or ear, nose, and throat physician. As a general otolaryngologist, I provide services that are in line with that profession. So we treat illnesses of the ears, such as hearing loss or ear infections, the nose, like allergic rhinitis or sinusitis, and also the throat, which can encompass anything from swallowing issues, voice issues, and even cancers of the throat. It is always something that I have wanted to do according to my parents. But as far as choosing my specific field, I did not choose that until I was in medical school. Our first year and first semester, we spent a full semester in an anatomy lab, and I fell in love with the anatomy of the head and neck region, and it became an obvious choice to choose the specialty that I chose. As I provide care to patients in my office, I try to make it a discussion. I don't think that it is the place in medicine any longer to be a dictator and decide everything for a patient. So I try to gather all the information that I can about what's going on with the patient, and then use that information as well as my physical exam to help guide them for a treatment that will be best for them, utilizing the data that we have at hand as well as any evidence-based medicine that's available. And at times that means medical management for problems, other times that does mean surgery. I love the community feeling of Good Samaritan Hospital. I grew up just nearby in Sullivan County and had always had a desire to come back locally to help provide care for patients that otherwise they would have to travel a far distance to receive. So I like being in the community and being able to provide that service. And the people, I think the people are what make Good Samaritan. Not only the employees here and the people in my office, but the patients. The patients are definitely the best part of my job. It truly is the people and the patients. I see a variety of patients. I see patients who are tiny babies, and I see patients who are in the final days of their lives. And the spectrum of illness that I deal with is very broad. I deal with minor things such as ear infections, and again, more significant issues such as cancer. And that is something that keeps the day-to-day job interesting, and being able to provide some people with instant relief with a surgical procedure is also a very nice bonus to my job. In my free time, I spend a lot of time with my family. I am married and I have 2 children and 2 dogs, and so we spend a lot of time playing outdoors and spending time together as a family, as well as with our church family. I think if I had to put a billboard up for many people to see, it would say, be kind and consider others. I think we never know what someone is going through on a day, and oftentimes I am seeing them on one of their worst days, or at least a day that is not their best, and so I think that reminder is always useful.